Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. We have Sean here. So Sean is a firefighter, right?
That's
and
right.
he gets, he occasionally has, puts on his gear, has occasional back pain. We're talking about, we've educated a little bit on compression, what can cause low back pain, muscle tightness, so on and so forth. A couple of within history, he's given me a couple of pointers that are reminding me of maybe a little bit of compression coming on. And he's a young guy in his mid to late 20s. So I'm not expecting to have a major arthritic change in the spine, but like we've determined before, arthritic spine is not going to make a determination by age, so on and so forth, right? So this could be associated with work, with gear, with a previous maybe sport history, so on and so forth. So he has this little bit of a possibility of compression in low back. When we're doing exams though, we're not finding any positive exams that would identify a major compression or herniation or nerve type of a pinched nerve type of issue that we would normally experience with some patients that we do get positive tests with. So in general, we're just going to introduce chiropractic, adjust top to bottom. We want to have diminished frequency and diminished pain intensity. So any questions from you so far?
No, sir.
Nope, everything seemed pretty straightforward.
Yes, sir.
So we've already used hot packs, we've already used electronic stimulation. We're gonna get in, do a combination of a little bit of soft tissue work and adjustment, and go from there. So we'll have you set up right over here. Just a quick reminder, guys, when you see us on YouTube, Facebook, Instagram, like our pages, subscribe to our channels, please. Tag your friends. All right, we're gonna get some mobility right in here, okay? Relax for me. Very good. All right. Had you ever had that before?
No, sir.
All right. How'd that feel?
Good.
Very good. Excellent. All right. Let's have you lay face down right here for me.
All right.
So a lot of the questions we get commonly is, does that hurt? So Sean, does that hurt?
No, sir.
All right. So this is live, right? We're not, Sean is not a paid actor
No, sir.
to tell us it didn't hurt. Felt pretty good, huh?
Did.
All right, now I want you to notice something right away here. Notice how, with the cervical adjustment and some electronic stimulation, we got a little bit better balancing foot placement, okay? Patients come in with low back pain and wonder why I adjust their necks. Good. Take a deep breath for me. Completely exhale. Very good. Relax right here for me. Good. Relax here. Excellent. Let me have you lay on your back, lay on your side facing this way for me. Right over here. We're gonna go here. Okay. Top leg bent, bottom leg straight. Give me this arm right here. Good. Go right there. We're gonna try to get some low back movement here, okay? Take a deep breath. Completely exhale. Very good. Lay facing the other way. See how tight that low back is?
Yeah.
Did you feel any movement down there?
Yes, sir.
Good. Switch legs for me. Good. Give me this arm right here. All right. There. Take a deep breath. Completely exhale. Good. Lay face up for me. All right. Good. Good. Here, relax here. Good. Okay. Very good. Scoot up just a little bit for me. Okay. Good. Feel that?
Mm-hmm.
Did you feel it through the spine?
Yep.
One more here. Very good. Good movement. All right. I'll help you up here. How'd that feel for you?
Great.
All right.